Okay, convening the Committee on Health, Human Services, and Homelessness for the purpose of hearing an agenda for Tuesday, February 16th, 10 a.m. The chair would like to remind those that are planning to testify that we have your testimony in front of us. For the professionally paid ones, feel free to rest on your testimony, and all the members have it in front of them. And you know, they're quite smart and they can read. Okay, so first bill, HB 869, relating to special purpose revenue bonds to assist Luana Kai, a life plan community. Luana Kai?
This is Mary Munoz from Ziegler. I'm the investment banker for this project and in support of this bill. Luana Kai is a community-based not-for-profit that will own and operate a life plan community in Hawaii Kai, which will be comprised of assisted living, skilled nursing, and memory care, supporting a large independent living property with amenities. We have a very experienced team of developers and investment bankers who've done many of these deals on the mainland and who also developed and financed Kahala Nui in the Kahala district. So we have a lot of experience with these types of projects. Typically, these not-for-profits are financed using special purpose revenue bonds, which get passed through the state Department of Budget and Finance for tax purposes, but which are obligations of the nonprofit, not obligations of the state. So the issuance of these bonds does not in any way obligate the state to repay the borrowing, does not change the taxes for residents in the community. They are purely an obligation of the not-for-profit that will own the project and pass through for IRS purposes, pass through the state. Budget and Finance also is experienced with these kinds of bond issues and will vet the financing with me as we move forward. We've known since we did Kahala Nui that the Honolulu market generally is very underserved with this type of product, and our ongoing market analysis has confirmed that there is a lot of demand remaining yet for a project like this. So we're very excited about the prospect. That's okay. All. I'm finished with my comments.
Okay, thank you. Okay, Department of Budget and Finance provided comments. Members, any questions? Okay, seeing none, moving on. HB 980 relating to Adult Protective Services. Department of Human Services.
Aloha Chair and committee members. This is Daisy Hartsfield. On behalf of DHS, I'm the administrator for the Special Services Division. I'm going to stand by the written testimony that was submitted strongly in support of this bill. And I'm available for any questions. Mahalo.
Okay, thank you, Daisy. Okay, we have testimony from the Executive Office of Aging in support and Kimberly Supnet. Members, any questions for the DHS? Okay, seeing none, moving on to HB 983 relating to Spouse and Child Abuse Special Fund. Department of Human Services.
Aloha again, Chair Daisy Hartsfield. On behalf of DHS, the department stands by its written testimony in strong support of this bill, and I'm available for any questions.
Okay. Members, any questions? Okay, real quickly, the chair has a question. The request is to increase the amount going to the special fund by $2 million.
Yes, Chair.
Okay. In light of what's going on with the overall budget for the department, do you think that then it would be more appropriate that these funds go to the increase from the money that's being brought down from Family First, go into the general fund to support services all the way around?
No, Chair, I would disagree, because what we are hoping to do is to use that additional monies to pay for the front end cost of the Family First services that we are hoping to implement in October.
Okay. Okay, so that would do the front end cost, and then after the initial payments from the funding, do you expect this funding to be ongoing?
Yes, Chair.
Okay. Okay, thank you. Okay, moving
You're
on.
welcome.
Okay, moving on to HB 98. Oh, I did that one, right? 983? Yeah, so moving on to HB 975 relating to reports of child abuse. Department of Human Services.
Aloha again, Chair. This is Daisy Hartsfield on behalf of the Department of Human Services. The department did submit written testimony. We are in support of this bill, and we would ask that the effective date be on or before June 30th of 2021, and I'm available for any questions.
Okay, thank you. Members, any questions? Okay, seeing none. HB 984 relating to the Office of Healthcare Assurance, Department of Health.
Good morning, Chair. This is Keith Ridley on behalf of the Director of Health. We stand in strong support of this measure, and I'm available for any questions. Thank you.
Okay, thank you. Members, any questions for Mr. Ridley? Okay, seeing none. Just real briefly for Department of Health, the amount and then your specified efforts. I know it goes to improve health outreach efforts and programs. Does that include investigations?
Yes, it could. It certainly could.
Okay. The chair then would like to state to give you, since I know we addressed this in another measure, but to highlight that you guys also an investigative body to ensure that you guys have that ability. So are you opposed to putting that as part of your health outreach efforts and programs?
No, Chair, not opposed at all. Thank you.
Okay. Thank you. Okay, members. Okay, moving on to HB 990 relating to marriage license fee. Department of Health.
Good morning, Chair. My name is Matthew Shim. I'm Chief of the Family Health Services Division, Department of Health. The department stands on its written testimony in strong support, and I'm available for any questions. Thank you.
Okay, thank you. Members, any questions for Department of Health? Okay, seeing none. Members, sorry, I have a question for Department of Health. This admin measure moves, it actually increases monies to these various special funds. So even though you're increasing the overall fee to $100, you're also siphoning it off to these special funds rather than it going to the general fund. Is that correct?
The general fund also receives a portion of the marriage license fee increase, and
but then all these other funds are also getting an increase, right? Is that correct?
Correct.
Okay. So the question I had for the Department of Human Services applies to you as well. Don't you think then that the extra money raised by these fees should go to the general fund and appropriated to health and human services related rather than these special funds?
Well, right now in statute, we have 4 FTEs that are actually funded and operations funded through the special fund, and the marriage license fee increase and the addition to the birth defects special fund will cover those folks who are responsible for implementing that program.
Okay. Yeah, but doesn't the current fund have enough in its principle currently to cover for those increases?
Actually, no, mostly because of the drop in marriages last year. And then the changes in collective bargaining over time. There has been no change since in marriage license fees since 2002, and obviously HR costs and salaries have increased.
Okay.
So we're trying to catch up.
All right. Okay. Thank you.
Thank you, Chair.
Okay, members, moving on to HB 991 relating to disclosures of vital records. Department of Health.
Good morning, Chair. My name is Lauren Kim, Policy Director for the Department of Health. This is an administration bill. Nevertheless, we are asking the Chair to consider amendments to our own bill that, upon further reflection, refines and makes more precise the level of sharing and scrutiny we would like to have with regard to vital records data. So this is a budget neutral bill, and we support strongly with amendments. Thank you.
Okay, thank you. Okay, we have Honolulu Police Department.
Morning, Chair. Michael Kunishimo, Captain of Honolulu Police Department, Criminal Investigation Division. We stand on our written testimony and support and here for any questions. Thank you.
Okay, thank you. Okay, and then we have testimony provided by the Office of Information Practices providing comments. Members, any questions? Okay, seeing none, moving on to HB 1281, Department of Health.
Good morning, Chair. My name is Danny Wong Tomiyasu. I'm Deputy Director for Department of Health. The department supports the intent of the measure to transition authority and responsibility for EMS services to the counties. However, the department does recommend initially limiting this change to counties with over 500,000 population. Additionally, the department strongly recommends that the state retain general oversight role to assure equitable standards that are met and statewide data collection, epidemiology, and analysis. Additionally, coordination between EMS systems and state EMS programs and injury prevention and trauma system programs continue to be important to public health. With the support of the legislature and governor, the department has opened preliminary discussions with the most populous county in the state to explore these opportunities. The department respectfully requests this measure pass out of committee to sustain this conversation with amendments to assure requirement for cost sharing with the counties, the continuing role of the state to provide oversight and setting of standards, and assurances that counties with populations less than 500,000 residents are out of the scope of this measure. Thank you for the opportunity to ask.
Okay, thank you. And then we have testimony providing by the City and County of Honolulu providing comments and HMSA in support. Members, any questions? Okay, seeing none. For Department of Health, the chair would like to express his appreciation both to the Department of Health, Mayor Blangiardi and his staff, EMS, for working over this past weekend, over the past several days to get a measure. So just to highlight, if the measure includes some of the questions addressed by Mayor Blangiardi for the transition to be for them over a period of 4 years with a drawdown. And I want to also thank the governor's office and address only for the 500,000 with the issue of making sure that the state is in charge of the overall emergency services reporting. That would be acceptable for the Department of Health?
Yes, Chair.
Okay, all right. So the chair will be presenting a proposed draft during decision making. Okay, thank you. Thank you, members. Moving on to the last measure of this agenda, Okay, Representative Ward.
The Department of Health, please. Could you name 2 things that will make this more efficient by transferring it from you to the city and county?
So what is your question? I think you broke off.
Sorry. To the Department of Health, could you name 2 things that will make this more efficient by transferring it from you to the city and county?
Thank you, Representative Ward, for that question. A couple things that come to mind very off the top of my head. There would be creating more synergy between other county services such as police and fire. The other thing that they could do is really expand upon the opportunities to enter into innovative concepts and innovative programs such as community paramedicine.
Thank you for that. May I ask the same question to the city and county?
They're not on.
They
only
were not
Department
on.
of Health.
Okay, thank you, Chair.
And the chair would like to address some of that since we've been working on it. Representative Ward, the state is losing about $51 million a year on maintaining this system because currently the Department of Health is the one doing collections. So right now the taxpayer is subsidizing all of EMS regardless if who's using it. So one of the ideas about moving this, not only for the counties to be able to run their own system, but also to have an increased ability to do better collections and then collect on what is due by those that use EMS.
But Chair, you're not assuming that the counties are awash in cash, which.
No, absolutely not. So we're
So collections is the issue.
right. So in the measure, we're giving them the ability to address their increased fees associated depending on the type of pickup or visit by the EMS paramedics, as well as we're looking at, since right now the state buys the EMS and they have to go through all that regulatory, that the city can then have the ability to work in consortium with HFD and to do some better services to the people.
But Chair, is it one of the variables, the homeless who obviously are never going to be able to pay for this? So the collection, if most of the losses are those who cannot pay, how can the city and county do a better job?
So because the collections right now is less than 50% by the state, that the city is better in regards to associating those fees to other things. For example, when people do real property collections, they have, especially in high traffic areas like in tourism zones in which you want to address that, they can actually levy those types of increases to assist with having more volume per particular area.
Okay, we shall see how it turns out.
Yeah, we shall see. Thank you. The success will be in the county's hands. Yeah.
Exactly.
Okay, thank you. Okay, moving on then to the last measure on this agenda, HB 1283 relating to health, Department of Health.
Aloha Chair, Lauren Kim for the Department of Health. Certainly we support greater dementia and Alzheimer's disease related training. We have submitted comments that suggest that the appropriate entity be the county offices on aging. Our proximity to other first responders, such as fire, police, is very limited in the state. Would also like to remind the committee or inform the committee that the Executive Office on Aging is statutorily responsible for managing the statewide Alzheimer's disease plan, and that this activity should be informed by those deliberations. Otherwise, that concludes my testimony, and I'm available for questions. Thank you.
Okay, thank you. Moving on to Honolulu Police Department. Okay, provided testimony in support. Alzheimer's Association.
Aloha, Chair. Thank you very much for this opportunity to testify. My name is Ian Ross. I'm with the Alzheimer's Association Hawaii. We're in strong support of this measure, and I go into detail in my testimony about all the reasons why. But I would just like to comment on one specific thing right now, and that is that we just heard from the Department of Health. And we believe their recommendations, we're not opposed to their recommendations. We believe they're well-reasoned and their amendments we're open to. Thank you very much for this opportunity to testify, and I'm available for questions.
Okay, thank you. I see that Officer Lambert was trying to, are you still there to testify and unmute? No? Okay. All right. We have individuals, Calvin Hara.
Aloha, Chair. I stand by my written testimony in support of this bill. Opportunity to answer any of your questions.
Okay, thank you. Okay, and we have Poki'i Balaz.
Aloha, Chair. Thank you. My name is Dr. Poki'i Balaz. I'm an advocate and vice chair with the Alzheimer's Association, and I stand by my written testimony. Thank you.
Okay, thank you. Okay, members, we have testimony provided by Amy Trong in support. Okay, members, any questions? Okay, so the chair has a quick question for the Alzheimer's Association. Ian?
Yes, Chair.
So in your, what briefly you mentioned is that you're okay then with Department of Health suggestion that that it's specified that it goes, that you guys work with the Office of Aging?
Yes, I believe we have a strong relationship with the Executive Office on Aging, and speaking with their director, I know that she's at least open to this idea. We're continuing to work out the specifics, but she sees how this fits in with the plan, but I can't speak any further for her position on it. But yes, we have a strong working relationship there, and I see that as a strong match.
Okay, so then in the bill, instead of saying the department may set standards, you're saying you guys are okay with the Office of Aging to set standards?
That's all right with us, yes.
Members, any question? Okay, seeing none, members, we will recess this committee until 11:30 to get quorum in decision making. Okay, and members that are listening, just remember we do have an 11 o'clock agenda. Thank you, everybody. Recess. Where's the agenda? Okay, opening the Committee of Health, Human Services, and Homelessness for the purposes of hearing measures on the Tuesday, February 16th, 11 a.m. agenda. Again, the chair would like to highlight to all the testifiers, we have your testimony in front of us. And feel free to rest on your testimony. Moving on to the first measure, HB 282, relating to minors. Governor's Coordinator on Homelessness.
Good morning, Chair. Scott Morishige, the Governor's Coordinator on Homelessness. Appreciate the intent of this measure to expand access for minors, and stand on my written testimony after and comments. Thank you.
Okay, thank you. Okay, Department of Human Services.
Aloha Chair, this is Daisy Hartsfield on behalf of the department. I'm the administrator for the Social Services Division. The department did submit written testimony, appreciates the intent of the bill, and provides comments, and I'll be available for any questions. Mahalo.
Okay, thank you. Okay, the LGBT caucus of the Democratic Party.
Good morning, Representatives. Michael Galoyu appearing on behalf of the LGBT caucus of the Democratic Party of Hawaii. We thank you for hearing this bill. We ask that you pass it out as is, and because we do need to get as much help as we can to our homeless unaccompanied minors. So I'll be available for any questions. Thank you.
Thank you, Mr. Galoyu. Okay, we have the Residential Youth Services and Empowerment.
Aloha Chair, Carla Hauser representing RISE. We submitted testimony as well. Like Scott Morshige's office and DHS, we appreciate the intent of the bill, and we would like to continue to work with DHS on the language with regards to the definition of a provider, so that we can continue to do the work in supporting the unaccompanied minors that we see annually.
Okay, thank you. Okay, and to note that we have testimony from Pride at Work Hawaii in support, Hawaii Youth Services Network and support Partners in Care and support Pride at Work in support, Vehi Kamakawawale in support. We have Mike Galoyu Sr. in support and Eileen McKee in support. Vice Chair, any questions?
Yes, I do. I have a question for Carla at RISE, please.
Yes, sir.
Yes. So Carla, I just want to thank you for your area in work for youth homelessness. I understand that shelters right now allow adults, even young adults, who are not able to shelter people under the age of 18 overnight, but can you allow them to visit during the day?
Yes, we can. We have drop-in services 12 hours a day, 7 days a week from 8 a.m. to 8 p.m., where young people can come in and receive basic needs services. That is all for naught when at 8 p.m. we have to send these minors back out to the streets.
Have you ever had to ask a child to leave in the evening?
Yes.
And where do they usually go?
Back to the encampments where they currently stay. In cases where we've experienced youth who are being abused or neglected, we have made calls to DHS to report minors, unaccompanied minors that are in crisis. But unfortunately, being homeless is not enough to be a reportable offense to engage child welfare services. So often these young people are forced to linger in our encampments and in our beach parks until they turn 18, and then they show up to RISE seeking shelter.
Thank you so much. My next question is for DHS. So my question is, why haven't you licensed any shelters facilities to allow minors and young adults such as 17 and 19 years old to stay overnight?
So, Representative, there are certain conditions that need to be met in order to be licensed as either a child care institute or a child placing organizations, and not all shelters meet those requirements. Part of the reason is because they provide services for adults as well.
So is it the department's position that minors are safer on the street than in those shelters?
No, it's not. And that's why we're trying to work with our community partners to figure out how we can better assist this specific population.
Okay, thank you so much. No further questions.
Thank you. The chair has questions for the coordinator for homelessness.
Thank you, Chair.
Hey, Mr. Marshige, I see in one of the testimonies that you'll be having meetings with providers to look at a definition.
Correct. We have a meeting scheduled for tomorrow afternoon with DHS Child Welfare and representatives from both Partners in Care and Bridging the Gap.
Okay. Can you either invite to allow my vice chair, or if not possible, provide him with a summation of the feedback after that meeting?
Yes, I can circle back to Vice Chair Tam.
Okay, thank you. All right. You okay with that, Vice Chair? Yes. Okay, thank you. Moving on to HB 1119 relating to charitable organizations. We have testimony submitted by the Attorney Generals offering comments. So we have no one else on the list. So there is no questions or anybody to ask. So we will recess this hearing till decision-making purposes following the 10 o'clock agenda. Okay. Members, you okay with that? Okay, thank you. Recess. Okay, reconvening the Committee on Health, Human Services, and Homelessness for the purposes of decision-making on Tuesday, February 16th, 2021, the 10 a.m. agenda. Members, thank you. First bill, HB 869, relating to special purpose revenue bonds to assist Luana Kai, a life plan community. Members, the recommendation of the chair is to move this measure for as in HD1, only changing the effective date to July 1st, 2016. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 869, Chair's recommendation is to pass with amendment. Chair votes aye, Vice Chair votes aye. Rep Gates? Rep Gates? Voting on House, okay. Rep Har?
You gotta unmute, Rep Har. You're still muted.
Aye, sorry.
Rep Capella?
Aye.
Rep Lopresti?
Aye.
Rep Nishimoto? Rep Ward? Chair recommendation is adopted.
Okay, thank you. Moving on to HB 980, relating to adult protective services. Members, the recommendation of the chair is to move this measure as in HD1, making technical amendments and a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 980, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to HB 983, relating to spouse and child abuse special fund. Members, the recommendation of the chair is to move this measure forward as in HD1. We'll blank out the amounts and put a 7/1/2060 effective date with technical amendments. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 983, Chair's recommendation is to pass with amendments. Anyone with reservations? Any noes? Chair recommendation is adopted.
Thank you, members. Moving on to HB 975, relating to reports of child abuse. Members, the recommendation of the chair is to move this admin bill through as an HD1, changing the effective date to July 1st, 2060, and putting technical amendments. Any discussion, members? Okay, seeing none, Vice Chair.
Voting on House Bill 975, Chair's recommendation is to pass with amendments. Anyone with reservations? Any noes? Chair recommendation is adopted.
Thank you, members. Moving to HB 984, relating to the Office of Healthcare Assurance Special Fund. Members, the recommendation of the chair is to move this as an HD1. We're going to make sure that it's stated in here that one of the roles that this money and their job includes investigative powers. We're going to blank out the amounts, and we're going to be putting technical amendments and a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 984, Chair's recommendation is to pass with amendments. Anyone with reservations? Any noes? Chair recommendation is adopted.
Okay, thank you, members. Moving to HB 990, relating to marriage license fee. Members, we had a bill that's addressed that already in HB 727. We will defer this matter. Moving on to HB 991, relating to the disclosure of vital statistics. Members, the recommendation of the chair is to move this measure for putting in the Department of Health amendments, technical amendments, and a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 991, Chair's recommendation is to pass with amendments. Anyone with reservations? Any noes? Chair recommendation is adopted.
Okay, members, moving on to HB 1281, relating to emergency medical services. Members, thank you on this. We're going to be voting on an HD1. Just to let you know, the HD1 that has been worked on over the weekend includes the position of the Sitting County of Honolulu. Just to highlight, this bill will only focus on the Sitting County of Honolulu. It'll address transferring roles like billing to the city and the maintenance of their staffing. However, the state will retain roles that involve the statewide trauma and EMS services that we need to report to the federal government. Members, it'll be a 4-year transition period. Language have been submitted by both the Governor's Office, Department of Health, as well as the Mayor's Office in the draft file coming up. Okay, members, any discussion? Rep Ward?
Chair, however, the endorsement is so lukewarm by the city and county, it's going to have to do this. I have reservations. I just don't see a robust, yeah, we want to take this because it's a really expensive proposition. Thank you.
Absolutely. The devil will be in the details, right?
Yeah.
So as it progresses. Okay, members, any discussion? Okay, thank you. And then let me double check. We have to make technical amendments. Okay, and then we will, just to highlight, we will be making some references to the system service area rather than the service in general, because it'll be county led. Okay, members, any discussion? Seeing none, Vice Chair.
Voting on House Bill 1281, Chair's recommendation is to pass with amendments. Knowing the reservations from Rep Ward. Anyone else with reservations? Any no's?
Okay, thank
Chair
you.
recommendation is adopted.
Thank you very much. Moving on to HB 1283 relating to health. Members, the recommendation of the chair is to move this measure forward as an HD1. We will do the friendly amendment, which is to change from the Department of Health to the Executive Office of Aging, and we will put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1283, Chair's recommendation is to pass with amendments. Anyone with reservations? Any no's? Chair recommendation is adopted.
Okay, we end this agenda. Don't run away. Okay, members, reopening Committee of Health and Human Services for the 11 a.m. agenda for Tuesday, February 16th for decision-making purposes on two measures. First bill up, HB 282 relating to minors. Members, the recommendation of the chair is to move this vice chair's bill forward with an effective date of July 1st, 2060. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 282, Chair's recommendation is to pass with amendments. Anyone with reservations? Any no's? Chair recommendation is adopted.
Okay, thank you. Members, moving to HB 1119 relating to charitable organizations. Members, the recommendation of the chair is to move this measure forward. We're going to change the effective date to July 1st, 2060, put technical amendments to give time for the author to work it out with the Attorney Generals. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1119, Chair's recommendation is to pass with amendments. Anyone with reservations? Any no's? Chair recommendation is adopted.
Thank you, members. We're adjourned.
Thank you.